Retzius-Sparing radical prostatectomy. Robot-assisted radical prostatectomy is the most common surgery performed for the treatment of prostate cancer. Approximately 90,000 of these surgeries are performed every year in the United States of America. Retzius-Sparing is a modification of the original robotic-assisted radical prostatectomy and was first described in 2010. Based on a survey done in 2017, only 30 centers in the entire world perform this surgery. What is the benefit of having a Retzius-Sparing prostatectomy versus a traditional radical prostatectomy? 98% of men who had the Retzius-Sparing prostatectomy were able to control their bladder at 12 months, versus 81% of men who had a traditional procedure. And men were able to control their bladder more quickly after the Retzius-Sparing procedure, 49 days after the surgery versus 64 days after the traditional surgery. There was no difference in recovery of erectile function in men who underwent either procedure. Because with this new approach where the prostate is accessed from behind, no men developed inguinal hernias after the Retzius-Sparing procedure versus 12% of men who had the traditional procedure. Finally, because with the Retzius-Sparing procedure, some of the arteries above and in front of the prostate are not touched, we believe that this reduces the risk of Peyronie's disease, or penile curvature, as well as penile shortening. No men who had this procedure developed penile curvature after the surgery versus 9% of men who had traditional surgery. Dr. Hugh has published papers on how to perform this procedure, as well as papers on the differences and outcomes of this procedure versus traditional prostatectomy. This is the male anatomy. The prostate lies underneath the bladder, in front of the rectum, and behind the pelvic bone. Between the prostate and the pelvic bone are many veins, arteries, and nerves that are important for urine control and erectile function. In the traditional robotic approach, the bladder is separated from the front of the abdomen so the prostate can be accessed from the front, between the bladder and the pelvic bone. This results in many veins and arteries being removed along with the prostate. In the Retzius-Sparing method, the prostate is accessed from behind the bladder. This allows the prostate to be completely removed while leaving the veins and arteries in place. By allowing those blood vessels to remain in place, the outcomes with the Retzius-Sparing method are better than the traditional method. Because the incisions used in this surgery are so small, and therefore result in relatively little pain, typically the catheter is the main source of discomfort during the first week after surgery. With the Retzius-Sparing approach, a catheter can be put in through the abdominal wall instead of through the urethra. This is called a suprapubic tube. This allows the patient to avoid the discomfort of having a catheter in the urethra for 7 days after surgery. The suprapubic tube can be removed in the office by your surgeon, and the wound is so small that no stitches are typically needed. If you have any questions or would like to schedule an appointment with Dr. Hugh, please call his office or visit his website.